transplanted cells. We've also studied another interesting type of a cell known as the mesenchymal stem cell. We've discovered a way of generating these through what's called a hemangioblast intermediate, so we can actually get very large numbers of these. And it turns out that we can get 4 to 5 orders of magnitude more than you could get from the normal source, which, for instance, would be bone marrow. And this just shows you the power of these cells, extremely potent. This is a study we published not long ago in a mouse model of multiple sclerosis. And so what you're seeing in that figure is a clinical score. So at the number 2, that's where they're starting to drag their hind limbs. At 4, they're completely paralyzed. They can't move. And as you can see, the untreated animals in those graphs basically are all paralyzed with time. One injection of these MSCs, and these animals are able to basically move around, jump around quite normally. And you actually see the moving animals. The one mouse that isn't moving is untreated, and the animal that got an injection of the MSCs is able to move normally. Oh. Okay, let's see. Okay, great. So we also wanted to test these in some other animal models. So another serious medical disorder, obviously, is lupus. This is a disease that affects anywhere from over 300,000 to 1.5 million Americans. There's basically no treatment for this autoimmune disorder. And about 50% of these patients actually get lupus nephritis, kidney failure. And what you're seeing in the figure in the lower left is you can see a glomerulus that's from a healthy patient, and the one next to it you can see is the diseased glomerulus where the immune complexes have clogged it up. And then you see the graph with the green, red, and blue. And these are animals that get lupus spontaneously. And you can see in the red, these animals start to die very rapidly when they're untreated, very similar to humans in terms of the disease process. In 1 or 2 small injections of these cells, and we were able to prevent the animals from dying. But also importantly is that the lupus nephritis, you get kidney failure. In the bar graph in the far right, what you're seeing, the first bar actually is animals that were untreated. So what happens is when you lose your kidney or it gets diseased, protein starts to leak into the urine. That's known as proteinuria, and you can see quite a bit of that in the untreated animals. And then in the far right bar, you can see with a couple small injections of these cells, we were able to prevent that pathology in the kidney. We also looked into some animals that got severe Alzheimer's disease, and what we were able to see was just even a systemic injection of these, not even intrathecal into the brain, we found that the animals, we were able to cut the number of amyloid plaques in the brain in half. So the next step will be is to see how that impacts cognitive function. And more recently, we also carried out a number of studies in dogs. Dogs get diseases very similar to we humans. These are large animals with sophisticated immune systems, so they're ideal to look at some of these autoimmune disorders. So German Shepherds, for instance, do get a disease known as anal phonunculosis. It's an analog of Crohn's disease. And it turns out that we went into these dogs that were resistant to conventional therapy, which normally would entail the use of cyclosporin and other powerful immunosuppressor drugs. But they were resistant even to those conventional therapies. And we went into 6 of these dogs, and all 6 of those dogs went into complete remission. So that's just one autoimmune disease, but in humans there are over 100 autoimmune diseases, in addition to multiple sclerosis and lupus, there's osteoarthritis, diabetes, the list goes on and on. But in addition, these cells, we know that they're likely to have an impact on other diseases such as kidney failure, liver failure, or even pulmonary. So there's a lot of applications that you could use these cells for. In addition, these are immune modulatory cells, so you don't have to worry about immune rejection. You can just use them off the shelf. Another exciting cell type that we've been working on is something known as the hemangioblast. This is a bipotential cell that actually existed when you were an embryo. It became your entire vascular system as well as your immune system. And we don't have cells quite like that in the adult body, but with embryonic stem cells, or actually with iPS cells now. And by the way, iPS cells, you can now generate those from just skin cell or a sample of blood. In fact, Yamanaka got the Nobel Prize for that last year. So we can do most of what I've described here using those cells. It doesn't involve embryos at all. And so we can create these hemangioblasts, and they're very smart cells. And so it's sort of like a nanoparticle. You can actually label them with a marker GFP that's green and inject them into animals and see what they do. So in the figure at the top, what you're seeing is something called ischemia reperfusion injury to the eye, where if you apply pressure, you can damage the retinal vasculature. And if you inject these labeled cells, you can see the green. Within 24 to 48 hours, they home to that injured eye and start to repair it. And the little inset with the red, that's the contralateral eye. The cells don't go there, so they will only go to where they're needed. So if you have damaged tissue that sends out these chemical signals that say, help, help, these cells will go to it, whether it's a damaged cartilage, a joint, or whatever. Similarly, in the lower left, you're seeing another example where we use these hemangioblasts. These are rats, and what you're seeing is the hind portion of them. So you're seeing the tail and the leg with the blood flow with a Doppler. So that's the degree of the blood flow. And you see a little circle on the left limb. There's no circulation to that ischemic limb at all. One injection of these hemangioblasts, and you can see within a month completely restored the limbs of these animals. So there are people, as we're sitting here at the hospital, having limbs amputated, that in the future the doctor will just give them an injection of these cells and hopefully restore the circulation. And then in the far on the right lower portion, that was a study carried out at the Sloan Kettering here in New York with Malcolm Moore's group, and we actually were able to go in with these hemangioblasts into animals that had severe myocardial infarcts and cut the death rate after the heart attack in half. We can also turn those cells, like I mentioned, they're bipotential. Not only can they become vascular cells, but we can turn them into a range of different hematopoietic cell types. So what you're seeing here on the left is a tube of red blood cells that we generated in the lab from these cells. They transport oxygen just like normal transfusible blood. In fact, we've made an IPS line from an O-negative patient, so we can now make blood that would match virtually everyone in this room. We can also turn those cells into very large numbers of platelets. Of course, obviously, there's a shortage of platelets, and they only survive for a few days. And these can be actually preserved, so we can freeze down the progenitors for a surge capacity should you need them. And they also are able to form clots and also incorporate into thrombi in animals, just like normal platelets. But in addition to being able to make all these interesting individual cells, we also have the capacity to reconstitute these into more complex tissues and structures. This is the area known as tissue engineering. And in fact, there's already being significant progress being made. This is a bladder, an entire bladder that was grown in the lab by Tony Atala's group. He's already using these bladders in patients as we are here today. And a few years back, we actually did a study with Dr. Atala's group where we actually made miniature kidneys. So in this particular case, what we did is, this was actually work that was done in cows. So we took a skin cell from the ear of one of these cows, or from several of these animals, and using therapeutic cloning, we were able to generate genetically matched renal cells that were seeded onto a polycarbonate membrane. So this is a miniature tissue-engineered kidney. And we transplanted it back into the nuclear donor animals. And a few months later, after we removed them, what you saw is, you can see that yellow material that looks like urine, well, it is in fact urine. These were actually detoxifying materials from those animals. And when you looked at the urine, you could actually see elevated amounts of urea and creatinine that had been removed from the blood of the animal. And when you did a cross-section histologically, you actually saw that these cells were smart and assembled into glomeruli, into tubules, and that they actually connected up in a unidirectional fashion with the polycarbonate membrane so that they could concentrate these materials very much like your kidney would. So someday in the future, you'll get into an accident, you lose your kidney, we'll just take a skin cell or a little bit of blood and we'll grow you up a new kidney. So a lot of exciting things happening in this field. Thank you very much, and I would like to thank the people who are doing this work, the people at Akata and academic collaborators.